Sir, for the kind introduction. At the outset, I would like to thank the organizers for inviting me here today. And I'm going to be speaking on the shrinking urban-rural divide in India in terms of diabetes. What are the implications? Now, to answer this question, one must look at the prevalence of diabetes in India, and for this, we will turn to the ICMR India Diabetes Study, or the INDIAB study for short. Now, this funded by the Department of Health Research and the Indian Council of Medical Research is a national study on diabetes and other cardiometabolic risk factors in the whole country. As you can see, it's a door-to-door survey of individuals aged 20 years and above. It's a very ambitious study, and we plan to do the whole country, and it's being done in phases with a total sample size of 1,24,000 individuals in the study when completed. So where are we today? Initially, in phase 1, we did 4 regions, Chandigarh, Jharkhand, Maharashtra and Tamil Nadu. We then went on to do the next 5 states in the mainland, Andhra Pradesh, Bihar, Gujarat, Karnataka and Punjab. We then moved on to the northeast, and we've actually completed all the states except 1, but I'm going to be showing you data from 4 of these states now with a total sample size of 52,000 individuals as of now. So now looking at the prevalence of diabetes and prediabetes. Shown here are the prevalences of the 13 states of which we're showing you the results. As you can see, the prevalence of diabetes here kind of varies very widely from 4% to almost 14%, and in between you can see it's about 7 or 8% in between. So if you look at the heterogeneity in the prevalence of diabetes, it's very varied. So you can't say if you studied only Bihar, perhaps you would say it's 4% or 5%, or if you looked at only a union territory there, you would say the prevalence is 14%. So that is the thing with India, the vast heterogeneity in prevalences. Now, what about prediabetes? Well, the numbers are slightly higher here, but the variation remains. It goes from about 6% to 15%, and you can see all of the states that have been shown here. Now, looking at this through the eyes of urban and rural differences. So, are there differences between urban areas and rural areas? Well, there are definite differences, and these bars here show you that. The red indicates urban areas, the green indicate rural areas, and one look at it tells you that yes, there are vast differences between urban areas and rural areas across the country, and these are just the various states, and you can see clearly that the urban and rural areas are quite different. Now, looking at this, you would say, okay, so we have a problem, and that problem looks like it is only in urban India. Rural India, well, the prevalences look rather low, so perhaps it's not a really big problem. Perhaps that's what you would say looking at these slides. But then, if you look at the increasing prevalence of diabetes, both in urban and rural India over time, now this is bit from 1991 till about 2014, the red again is urban. Look at these prevalences. They increase from 4 to about 11, almost 12% here. So that is the increase in urban prevalence, and that's 180% increase in prevalence over these few decades. But if you look at the rural prevalence now, again it goes from 1.5 to 5.4. So although it is much different from the urban prevalence, it looks like the rural is only half of the urban, that's actually a 260% increase in rural areas. Okay? So yes, there are differences. These differences are quite wide. For example, urban is double that of rural, but the point to take here is coming up in a second. So what, you might ask, okay? Okay, there's a little urban, there's a little rural, and rural isn't so much. But fortunately or unfortunately, about 70% of India still lives in rural areas, and 75% of all our healthcare professionals live in urban areas. Okay, so if you now take these pooled prevalences of 11.5% urban and 5.4% rural, and then look at the actual number of people with diabetes in these populations, in urban areas you have, well, almost 27.6 million. So that's almost 28 million people with diabetes, and that's a lot of people with diabetes in urban areas. But now, look at this really small number of 5% and look at the number of people in rural areas. It's almost 26 million. So it's almost exactly the same as the urban areas. So that is the problem that we have with the rural population, simply because of the number of people that we have. So even a small 5% prevalence translates to very big numbers. Now if you look at it, there is an equalization of the actual number or the actual burden that we have due to diabetes, both in urban as well as rural areas. Well, so what, you might ask? We have a lot of people with diabetes. Well, this is what happens. If you have people with diabetes, well, the recommendations say that their HbA1c should be less than 7 to prevent complications. So how many people actually meet that criteria and have a HbA1c of less than 7? This is urban and this is rural. It's about 30%. So only 1/3 of all these diabetics have their sugars under good control. The rest of them, 60% of them, are at risk for all the macrovascular and microvascular complications. Now let's translate this into burden again. Now what happens? In urban areas, we have 19 million people with uncontrolled diabetes. What about in rural areas? It's almost there. It's 18 million with uncontrolled diabetes. So that is the problem we're talking about. Again, look at the equalization that has happened in urban and rural India. If you look at the prevalences, they look different. It's only half. Rural is only half what is urban. But when you look in practical terms of the number of people with diabetes, what we need to treat, what we need to achieve, actually there is no difference. And you will see that in urban as well as rural areas, we have a problem. So what are the unique challenges that come to rural areas now? You have, okay, in urban areas, there are 27 million diabetics. Well, there are lots of doctors as well. There are hospitals, there are doctors. Awareness is more, literacy is more in urban areas. Now, what about rural areas? Well, all the converse is true, okay? We don't have doctors. We don't have enough healthcare facilities. Awareness is low. Literacy is low. All of these things. There's limited access to medical care. There's transport. You have to go so many kilometers to reach even the nearest PHC. There's no affordability. Socioeconomic status is less. There's no healthcare resource. There's poor infrastructure. They don't have the latest medicines. They don't have anything there. So these are the problems that we have in rural areas. So not only we have an equal number of people with diabetes, these people have difficult access to healthcare and other facilities that people in urban areas have. And that is the status we are in today. And that is the unfortunate state of affairs in India today. So then, what can we do about it? Well, obviously, the need of the hour is to make diabetes care available, accessible, affordable, and acceptable in rural India. That seems to be the most logical thing to do. And one of the things that we have done here was called the Chunampet model for rural diabetes care. This involved the World Diabetes Foundation, the Indian Space Research Organization, and the National Agro Foundation, as well as the Madras Diabetes Research Foundation. And through this, we tried to reach out to the unreached people through tele-diabetology. And this is what we did. There was a mobile van which served as a mini diabetes hospital. We could screen for diabetes. We could also screen for most of its complications. We had a retinal camera in it, a Doppler, biopsymetry, ECG. There was our van driver kind of doubled up as our technician. And through these, we were able to screen, go out into the rural areas and deliver diabetes care at their doorstep. So this is what we did. So we went to about 42 villages in this Kanjipuram district in and around Chunampet. We screened 23,000 individuals. In that we had 1,235 diabetics, and shown here are the prevalence of the various complications that we screened for. But I draw your attention to the last part of the slide here, and that is this. When we first went to these people, their mean A1Cs were 9.3%. And after the screening, we would then had people, we had diabetologists there, we then had people reaching out to them, trying to control their sugars. And when we went back after a year or so, again to the same population to screen, we found that the A1C had come down to 8.5. And those of you who are in the business of treating diabetes do know that this is no mean achievement. And this is not just in one person or two people. We're talking about an entire population here. An entire population of people, the mean A1C has come down. So obviously, this is one of the things that we can do. It's not the only thing that we can do, but it's perhaps one of the things that we can try to do to reach out to people, deliver diabetes care in rural areas. Now, what about the risk factors? So one thing is, yes, there are lots of people with diabetes. Yes, let's reach out to them and try and treat them. But what would be even better is if we tried to prevent it even before it came, right? So we know that the pre-diabetic pool is so high. So can we prevent these people from turning into diabetics? Is there something we can do? Yes, there is. And obviously, let's look at the risk factors here. So this is the prevalence of physical activity and inactivity across the country. And shown here are the, sorry about that. Shown here are the inactive people, or the so-called sedentary people, those with sedentary lifestyles. And in urban areas shown in red here, it's 63.8%. Actually, this includes urban and semi-urban areas, and that's why it looks a little low. If you actually take only metropolitan cities, this is nearing 80%. So 80% of all people living in metropolitan cities are quite sedentary in their daily lives. Whereas if you put in everything together, then it comes down. Okay, that's something that we kind of expect. You're not terribly shocked by that piece of information. But now, look at rural areas. Okay, that's where you expect people to be working in the fields all the time, being quite active. And there, if you look at the prevalence of sedentarism or inactivity, it's 50%. So 1 in 2 people in rural areas are sedentary as well. So it's not just a problem of urban areas. This is shifting to rural areas as well. Well, so what? You might ask. People are sedentary. Very simple. You get diabetes. The more sedentary you are, the more diabetes you get. And that's shown here. This is the prevalence of sedentary behavior shown in red. This is moderate activity and vigorous. It's quite clear. The more active you are, the less diabetes you have. Okay, so that's about physical activity. Now, what about dietary factors here? Shown here again is data from INDIAB, and I'm showing you the differences in what people eat in urban as well as rural areas. I apologize for the busy slide. It's quite simple. I just want to say one point here. Now, in urban areas, we all know that people eat more of everything. Okay, they have high socioeconomic status, affordability, and thus they eat more calories, they eat more protein, they eat more fat, they eat more of everything. Except, that's what I want to show you. Look at the carbohydrate consumption. It's actually higher, significantly so, in rural areas. And most of that is coming from refined cereal, which is higher and not actually different between urban and rural areas. So although people in urban areas are eating more of everything, in rural areas, the primary percentage of everything they're eating is carbohydrate, and it's refined cereal. Again, you might ask me, okay, so what? So this data here is from the CURE study, which we showed that this is what people eat basically in India. And you can see this is refined cereal standing out separately there. And this is the risk for diabetes. Okay, with everything that you eat, these are the various things, fruits and vegetables, tubers, etc. Look at the refined cereal. Look at the risk for diabetes. It just stands out so separately. That one thing, that one part of the diet is responsible for diabetes in our population. The only other thing that I want to talk about diet is fruit and vegetable intake. Everybody knows that the WHO recommends that you take 5 servings of fruits and vegetables for health. Now, how many people actually meet these recommendations? Well, that's the good part here, okay? It's only 12% in urban areas and 6% in rural areas. Terribly low. Okay, so how many people eat fruits and vegetables? 5 servings every day. That's supposed to keep you healthy. Well, that's where we fail quite a lot in urban as well as rural areas. It's quite low. And then so what? Well, you're losing the protective effects that fruits and vegetables give you for protection against diabetes. And these are the protective odds that we have shown here for more or less than 5 servings of fruits and vegetables. We also did one last thing, and that is what we call the population attributable risk, or PAR for short. So what this tells you is it tells you how much of diabetes can be actually prevented if you control for various risk factors. And I just want you to look at the first model here, where we looked at diet and physical activity alone. Just take these 2 things, okay? What we showed is that about 50%, more than 50% of diabetes could be, theoretically at least, be prevented if we just controlled these two things. Okay, so I showed you what the dietary flaws were, where the physical activity flaws were, and if you just control for these two things, more than 50% of diabetes can be prevented. Of course, if you add on many other things, obesity, certain cholesterol parameters and things, we've showed that more than 80% of diabetes actually can be prevented through lifestyle intervention. This is, of course, of considerable use in the planning, implementing, and evaluating effective strategies for the prevention of diabetes in India. Okay? So now coming back to my topic, the shrinking, I think I've convinced you that indeed there is a shrink in the urban and rural divide. And what can we do about it? Well, we can deliver good care, but what we can actually do about it is prevention, prevention, prevention. Try to decrease this shrink, okay, or let's try to shrink the divide by decreasing the prevalence in urban as well as rural areas. And how do we do that? Well, we can't do much about what has already happened, but we can prevent all these people in the pre-diabetic pool who will convert at some point into diabetes from getting that. And how can we do that? We can do that by simply controlling lifestyle. So let's make prevention our mantra there. Let's empower people, make them aware. Let's teach people to say, preventing diabetes, this is my choice. Thank you very much.